Thank you very much for the invitation and the honor to address this European Congress. Dear Kari Steindal, listening to you, I was very glad, and I hope Germany will go in the far the same way as Norway does. And I intend to present you our social competence training for adults and adolescents with Aspergers and high-functioning autism. And there are two reasons for my presentation. The first one is very obvious. If you train social skills with this patient group, okay. Thank you. Thank you. You touch a core problem of people in the autistic spectrum. And so there have been many good practice examples in different countries in the world. So we have tried to integrate the best of the ideas and techniques in our program. But the second reason why I present this program is, and I think this is for me, the most point, and that is my deep conviction, that we have to get care for people in the spectrum from the fringe of the psychiatric and psychotherapy profession into the mainstream. That is especially true for a country like Germany, where autism tends to be ignored on a wide scale in the healthcare system. Most of the university hospitals are very good in offering ADAS tests at the best, though producing diagnosis, but leaving afflicted persons and their families all alone afterwards. So most of the people get some non-specific developmental support, and their life is social exclusion in working and living facilities. And so I think the very big point is get them from the fringe away and get them and open the doors for them in professional ways. So what we did is something interesting, not because we developed one more social skills group training, but because we did that just in the middle of mainstream mental health care in a small cognitive behavioral therapy specialized hospital, mostly dealing with anxiety, OCD, affective and post-traumatic stress, and eating disorders. Our hospital offers about 40 inpatient places with therapist and patient ratio 1-to-1, using evidence-based and guideline-oriented procedures exclusively, and they're boasting very short hospital times and excellent long-term results. We then started an outpatient Aspergers and high-functioning autism program, later on inpatient care as well, because we were convinced that this hospital had all the expertise needed from its everyday work with cognitive behavioral therapy, such as skills in behavioral analysis, clear and transparent procedures, and well-trained therapists. There were skeptic voices, of course. Will these patients really have a profit? Are we good enough to transfer knowledge and experience from other conditions to the autistic spectrum? And this is what we did. We had, the organization is 15 therapy sessions weekly, 100 minutes, and 2 psychotherapists per groups. There were 6 patients maximum per group. In our patient, there were 1 woman and 5 men. And that were the therapy models. Getting to know each other, working with emotions, coping with emotions, planning and organization, social rules and interaction, and final sessions and evaluations. We had a big interest in knowing what they want to do, and that the schedule is, so we planned it together with the patients when the course of the lessons went away. First of all, the special traits and strengths of the group members. The special traits, structure, planning, transparency, instructions are needed. Indirect communication, expression of emotions is very difficult, and often given information about their own emotional and motivational state is very diffuse. The strengths, the patients always wanted to work on their resources, and that was very impressive for us. They were acute, reliable, competent in reading of emotions, social interaction, taking care of each other. They were very interested in each other. Group rules are respected, social sensibility and openness, high level of motivation, attention. The general strength, as you all know, is systemizing, memory function, detail recognition, orientation in space, visual apprehension. So first we started with getting to know each other like we do with all other patients in group therapies, interviews, working with wanted posters, psychoeducative description, and the college Who I Am. I will show you some examples. We started with the round table where we asked them to say how they feel when they start the group and to tell something about the week they had. And that was very, very hard for them to do this, and it was a große Herausforderung, as we say. We ended in closing roundtable. Each point we were working with them. They gave us a feedback for each point of the lesson session. This is a wanted poster, and they did it in interviews, their names with the photo and all this. And then the collage, what they are, the dream of, the hopes they have, and what of problems they have in their days and in their activities. And the most of it, it was for them very important to talk about their stress, about their work stress they had with colleagues and with their chief, for example. Working with emotions, coping with emotions. It was very important for the patients, and they told us it was very helpful to get psychoeducational. What kinds of emotions exist? How are they expressed? Why are they there? And how can they show them? We had a playful intervention with them. We played a lot with them, like displays, and it was for them. They had growing in self-esteem. They have not much lack in knowing the situation, like cognitively, but really to accept it and do it in your daily life is very, very hard. So they get a lot of work in the group, but we always give them homeworks. So they have to do something in the week too with their parents and their peers and their colleagues, and that was very good for them to come back and tell us about the things they had experienced. This was very helpful in seeing what is the emotion and just to go very step by step. And they say that they use it in their daily life. What we experienced was it's not so really that they need to know a lot, but they have to do a lot of experience in their daily life. And this was very important to generalize the things we do in the group. Planning and organization was another very important point. We cooked together and eat together, and we had an adult group and a teenager group, and they meet together and do positive activities, which was very exciting for both and for us. Social rules interaction. There it was very, very important to speak about things which are very implicit for us and make them explicit. This was very helpful for them. So we made arrow games, and we watched TV soaps, and then we talked about the soaps and the very different opinions and perspectives on it. And we trained nonverbal communication. And when I speak about train, it's just to analyze how do I do that? What of kind of different aspects can I use if I want? And then to train something in front of a mirror in a role play whenever I need this and I want this. The patients told us that role-playing games were very, very important for them. Not only twice or third times or four times, but just a lot of times, just play the same situation, play the same situation, play the same situations, and just repeat it. And what they really loved were discussion rounds, just to talk about problems and see different perspectives and get an orientation and feel that they were understood. They were not in the group to be changed, but to be there and to be accepted, and to choose: do I want to change this? Do I just to be aware how they function? We played pantomime a lot. and there were social situations, and everyone has to say what he thinks is an error. And our two therapeutic
5 minutes.
Okay, sorry. Were models, and so the patients can see there is no the answer to the situation, but it's very, very subjective. Final sessions were just results from the viewpoint of the group members, and changes in everyday life, passing compliments to the other participants. They really love to pass compliments to the other participants. Okay. My point is, when we started an outpatient program, So I encourage everyone who is qualified in CBT to look beyond the typical indications and to focus on autistic spectrum. There are a lot more valuable resources in the general mental health care system that should be open for autism. It is a great experience for both sides and step out of isolation and restricted therapeutic possibilities. Thank you very much for your attention.